Food is one of the cornerstones of lifestyle, and everyone who gets diabetes, their maximum questions, and as a nutritionist myself, we know their maximum questions are about diet and what to eat and how much to eat and what not to eat in diabetes. I know a lot of my, a lot of colleagues, and in the initial days when we learned about nutrition and dietetics in relation to any disease, we were always thought about what not to eat. We always, in initial days, we used to always say, don't eat this, don't eat that, don't. And then eventually, as times change, as psychology change, and we understand behavior better, I think that's the worst way to do it, because people don't want to hear what not to do. What they like to hear is what we can do, right? So now with times and now with new learnings, new research, what we advise is, well, there is this whole food and what you should take, what you should prefer, rather than advising people on what not to eat. So there are a lot of myths around this on what to eat, what not to eat. And most important, I always say moderation is the key for any diet. For any healthy, I don't really like the word diet because I think it has a negative connotation. What you should be talking about is healthy eating. And in healthy eating, moderation is the key. So you can eat everything, but please moderate. So immediately that comes down to quantity and over quality. So you have good foods, you have healthy foods. And if you're having some junk or whatever you're eating, has to be in good moderate amounts. So say you have a breakfast by around 8:39, instead of having 5 rotis or 5 idlis, you have 3. Have it with a tomato chutney or whatever you like to have with a side dish, but please ensure that you have a lot of vegetables part of your diet. So there are a lot of fad diets in the market. You have ketos and you have intermittent fasting, and every Tom, Dick and Harry who has just followed it and lost a few kgs start becoming an advisor on that. Please don't follow such people. It's a very superficial kind of way of doing it. Go to a consultant, to a qualified dietitian if you're really, really keen on following something properly, because you need to do tests before you go on any kind of a big plan, before and after. Only then you know how your other values and how this kind of diet is really affecting your body. So especially if you have diabetes, even more important, please do not start a keto or any kind of a diet without consultation with a qualified dietitian, because just going by what Google says, nobody's going to tell you all these other things. You might follow something, might even lose 10 kgs, but the effect it has had on your other blood parameters, on your liver, we have a lot of cases of people with kidney failure, liver failure, lots of things due to following a particular kind of a diet. And keto is coming out as one of the most common culprits for all these people. So please, whatever you follow it only in consultation with somebody who's qualified to give you advice on that. And I will even go a step ahead and say even doctors are not qualified to give you advice on diet. You have nutritionists, you have dietitians who will give you advice on that, because they are trained to do just this kind of work. Another common myth is not having carbs at all. So yes, a low carb diet is obviously directly related to the blood glucose in your body. So going a little low on carbs is healthy, but that doesn't mean you can cut carbs totally. You need carbs for your brain to work. You need carbs for a lot of other functions in your body. If you cut carbs totally, fat will start getting used up, and which is a way to lose weight, yes, but eventually it will start having other kind of issues in other kind of the organs of the body. So you have people, I'm sure you've heard of a lot of cases of late. I will give you a most common example, if I may, is of the famous choreographer who had a heart attack, and everyone knows he's a choreographer and he's very, very fit. So he was on a keto cum intermittent fasting diet for the last 1.5 years or so. And if you're going to have on a keto diet, you're going to be full of fat laden, remember? So that's also going to be causing a lot of blocks in your arteries and things like that. So if you're not doing an evaluation of a blood parameter versus the diet you're in, then you're basically taking yourself towards failure. Yes, you lose weight, you will look good, but then you're going to have other kind of effects in your body. So please, when you work on myths around diet, read up well and consult the right people and then follow it. Do not just go by what you read up or somebody who has just done this and follow them blindly. It's very, very important to have expert advice. Very important to have a lot of vegetables. So one of the easiest tips that I can give you is, when you take a plate to eat, this is called a healthy thali concept. If this is your plate, please divide it first into half. One half should be full of vegetables. We have the tendency, especially more in South India, where the half is filled with rice. So we need to change that practice and fill that half plate first with vegetables. It can be cooked vegetables, I would prefer a combination of raw and cooked. So you have some cooked sabzi and next to it some salad. Salad does not mean exotic salads. You just have to cut some kind of covishield or cucumber or onions or whatever, but some raw vegetable in the side and some cooked vegetable. The second half is divided as protein and carbs. So you have 1/4, which is carbs, whether it's your roti or rice, whatever should be in that 1/4, and the other 1/4 should be your proteins. So whether it's you're a non-vegetarian, it will include non-vegetarian protein. If you're a vegetarian, then it'll be dal, dahi, paneer, whatever you're having should be that 1/4. If you can try and stick to this kind of a thali concept, that's basically healthy eating for you. So that's the most basic and useful tip, is to change from having half your plate from rice, which is plated with carbs, to half a plate of vegetables, and then the other half, 1/4 with protein, 1/4 with carbs. I think I'll end with a last myth, which is the most common with relation to diabetes, is that people who eat a lot of sweets get diabetes. Now, if that was the case, then everyone who has a sweet tooth should have diabetes. It's not. So, yes, if you think about it, you think, oh, of course, diabetes means high blood sugars. So, anyone who eats sweets is going to get diabetes. It's not the case. As I said, it's all related to your build, your weight, your heredity, especially for type 2 diabetes. Type 1 has nothing to do at all with sweets and all that. But in type 2, it's more to do with all these other factors like heredity and things like that. But of course, once you get diabetes, you have to stop eating too much sweets. So that is why you stop at sugar, because 1 teaspoon of sugar is around 5 grams, and that is basically nothing but calories. It's straight empty calories of you're just getting so many calories of sugar. So you definitely need to cut the amount of sugar you have and the amount of sweets you have, but you need not go fully off a sweet diet. You can have in moderation. These days we call mindful eating. So you take a sweet, eat it mindfully, and that's it. You cannot, instead of maybe you were having 4 laddus or 3 laddus, you can have only 1 and have it in peace. If you go on a wedding or you go for a party, control the amount of sweets you have. Take bite size. You don't have to gobble the whole laddu. Take a few pieces of it, and just to this your sweet taste, that should be fine. So I think I've covered most myths around diabetes. I mean, I've explained it very briefly and in a nutshell. There are many, many more, of course, and we'll be happy to answer them. I'll be really happy to answer them. So kindly just post your comments below, and we will try and address them and reply back to you there. So thank you for listening, and healthy eating and healthy living.
Thank you so much, Dr. Ranjani. It was great to have you here on my channel today. I hope the session helped to answer a lot of questions about diabetes, its risks and complications. If you guys have any questions, please do drop a comment below. We would be happy to answer those. So if you guys enjoyed the video, please do like, share and subscribe to my channel, and follow us on Instagram and Facebook. The links are given below, and also please click on the bell icon while subscribing. It is time for me to sign off now. I'll see you guys soon in my next video.